Hello, everyone. I'm Pablo Gelber from Barcelona, Spain. It's really an honor, a pleasure to be here presenting this. Unfortunately, not in Lyon, but well, at least I will show you some aspect of the fresh osteochondral allograft transplantation of the patellofemoral joint. There are a lot of different clinical scenarios. I can't explain and talk about all of them, but we will face we'll talk about facing some of the most complex and challenging cases. Of course, when we are talking about this kind of treatment, we are not talking about superficial or shallow chondral injuries of the patellofemoral joint. Rather than this, we're talking on facing huge, at least 2 square centimeter injuries. And also, it's a very good indication probably in young patients for previously failed self-based therapy. As I said before, this is, of course, aimed for young patients. It probably is more important rather than have a fixed 50 years old threshold or limit. It's more important the biological age rather than the chronological age. As I said before, we're talking here when the osteochondral unit is really hugely injured. For example, facing this kind of patellofemoral joint in young patients, this clinical aspect of the patella, or you can see here different dysplastic or non-dysplastic trochleas with a severely injured cartilage. There are different conditions that influences of what kind of techniques and also concomitant technique we are going to perform. When we are facing isolated lateral aspect, lateral facet or lateral patellofemoral joint aspects problems, probably in this case we don't even have to work on the cartilage itself, and with if in the case is involving a higher TTT G distance than 15 millimeters. But when we are facing cases with a shorter TTT distance or cases with medial or center patellofemoral joint disorders, in these cases, probably more complex or invasive surgery has to be done. Of course, we are here in Lyon. I'm not going to discover how complex the patellofemoral joint biomechanic is, and also the shape of each trochlea or each patella has no comparison to any of them. Probably we can group around them, but they will be absolutely at least slightly different, the donor from the patient shape and 3D aspects. In any case, I would like to highlight some of the aspects when we are facing bipolar injuries in really young patients, like this 19 years old professional handball player who presented to the clinic with almost an invalidating knee pain for activity of daily living, or this professional, also volleyball player from the Russian Federation, 26 years old, who had several surgeries before, and she was almost invalidated to perform not only her sport, but also her activity of daily living. I will play a short video about patellofemoral joint replacement and bipolar injuries. Again, this is highly dependent on many different aspects. We can call this like a patellofemoral joint resurfacing biological resurfacing technique. This was somehow dysplastic trochlea. In this case, we are performing a shell technique in the patella because the injured was too high to perform bone plugs in the center of the injured patella. So this is quite similar to what we perform in a patellofemoral in a total knee arthropathy. Rather than using a shell technique in the trochlea, we use, as we are observing here, a bone plug or bone dowel technique. This was, if I remember right, it was a 26 millimeter defect or transplantation. Fortunately, it was a small patient, so with 26, which is the maximum I have in my instrument set from GRF, we could replace the whole injured trochlea. Here we are with some smart nails fixing the patella, and finally, this is a pre-fit technique, so we don't need any hard work to fix the trochlea in this in this host area. In any case, just to sum up, it is a technically and logistically demanding technique with many different other variables. We don't have time to explain about this. In any case, if you follow my Instagram account, you can find more details, more surgical techniques, and different challenging situations for the patellofemoral and other areas of the knee. Thank you so much.